Welcome to this edition of Extra Credit, the DMPS program that goes beyond our regular assignments for an in-depth look at the school district. Let's explore how Des Moines Public Schools help students take care of their health. Health Services Supervisor Diane Gladson joins us with more. Diane, thank you so much for your time. Can you tell us a little bit about Health Services?
So Health Services in Des Moines kind of follows the district's mission. We are here just to serve all students, and our goal is to make them all ready for that next step in life. In Health Services, our vision is to be the leaders in urban education for health services around the United States. So that's our overall goal.
And you bring that home every day at school with the kids.
Yeah.
Tell me a little bit about who you have on staff. What are parents and teachers and students seeing at school?
Okay, so on staff we have 66 nurses, including myself. So our goal is to have a school nurse in every building all day, every day, and we're working toward that. We also have 2 health associates, and they both have their certified nursing assistants. So we're really excited about the diversity that we have within our staff and the knowledge base. When we come together, we have nurses from backgrounds in pediatrics to geriatrics to surgical, med-surg, public health, and so we really have a vast amount of knowledge as a group.
And what kind of services are they providing for students?
Well, I think, people, when they think of the school nurse, they think of first aid and dealing with illness, and we certainly do that. It's a big part of our job, but it's so much bigger than that. As school nurses, we work with Polk County Public Health and the Iowa Department of Public Health and meet all the legal requirements of the school. So that includes immunizations, dental screenings, vision screenings, lead testing, just a lot of things that people aren't aware of. A big part of our job too is just making sure kids can access their education. Kids have health concerns, that people aren't aware of, and often they're are sharing that with the school nurse. And we work closely with the teachers and the support staff and make sure the kids have what they need to get into the classroom and access that education.
And when you're talking about accessing education, you're talking about removing those health barriers by assisting them so that they can do the work that's put in front of them and learn and grow.
Right.
What kinds of, you also talked a little bit about mental health. So we're not just dealing with physical health, but students can approach you with concerns about how they may be feeling.
Right, yeah. I mean, as school nurses, we look at the whole child. So we certainly look at physical health, mental health, psychosocial well-being, and we'll address all those needs. And we're always working too with outside agencies to help students and families access services. I mentioned earlier we just had some training with Please Pass the Love, and that's something we're hoping to push forward for all of the staff that work directly with students. Because yes, we do have, as all people do, have a mental aspect of the whole child, and so we want to address that as well. Kids come to us with depression, anxiety, attention deficit disorder, and so we work with families to make sure that they have the tools and the resources they need.
Do you, if you see something in a classroom or a teacher notices something in a classroom, do you contact parents in those cases and discuss concerns?
Yeah, that's a big part of our job, is just working with parents daily. You don't contact a parent every time you see something with a student, but if it becomes a pattern or if it just rises to the level that the nurse is concerned, absolutely we're having communication with parents. And we just do a lot of education too, not only with the parents but with the staff as well. Make sure that they're aware of what the child's experiencing and what's normal, what's not normal. Nurses are really good about, they know growth and development for the populations that we serve. And so we're good people to reflect back on that.
As we're getting students ready for class, and when I say we, I mean parents at home, what is the best advice you would give to us to make sure that our students are ready to learn when they walk in the door?
Yeah, I think it's best just to be open and honest. And if you as a parent are having a concern about your student, feel free to share it with the school nurse. And we can talk about how much of that information you want shared with others or not. So we can share it directly with the teacher that's involved or other support staff. We can work out plans. The nurses work with the 504 teams, IEP teams on attendance. So we're always involved in and trying to help educate staff what's best for students. The staff educational staff is good at delivering education. Nurses are good at making sure kids are well and ready to learn.
And as a parent, our conversations with you are confidential, right?
Right. I mean, we practice under FERPA. So if you would share something that's educationally relevant that the teacher should be aware of, I'd have that conversation with you. You know, so if you came in and said, my child has asthma and they take an inhaler and they have some PE restrictions or recess restrictions, you know, I'd let you know that I'll share that with the teacher and the PE teacher. We'll work together as a team, you know, and make sure that the student has what they need. It really just depends on the situation. You know, if you came in and there's some family dynamics that are very difficult, maybe a divorce or a separation in the family, I'd kind of reach out and say, is it okay if I share that with the school counselor? Maybe I'd get the social worker or success worker involved, kind of getting permission from the parent first. But yeah, our ultimate goal is to work together as a team, you know, so the kids feel safe, and then they know that they can go to the adults that they're with all day long.
Okay. Down to nuts and bolts. Okay. So I'm at home. How many hours of sleep am I looking at for my children?
Yeah. You know, it's funny you ask that, because one of our professional learning communities nurses just did a study on wellness, and sleep was one of the guidelines that they were looking at. And they put together a pamphlet off of the American Academy of Pediatrics looking at different age groups and what's appropriate for sleep. So, you know, that answer is going to vary. If you're talking about a preschool student, it's probably going to, and I'd have to look at the information, probably 10 to 14 hours a day, versus a high school student, it's going to need more like 8 to 10 hours of sleep per night. Yeah.
And nutrition-wise?
Nutrition is another thing that we always look at. We've worked with Every Step this year and really have promoted the 5210 program. I don't know if you're familiar with that, but really looking at, you know, 5 fruits and vegetables a day, 2 hours or less of screen time, 1 hour of exercise, and 0 sweetened drinks. And we have those posters in our buildings throughout the district. And that's really a good basic guideline, not only for the students, but for the staff and community as well.
And for healthcare, you recommend a primary healthcare provider outside of school, right?
Yeah, we really are trying to push that, because families, we want to look at wellness, not just go to the doctor when you have an illness or a problem. We want you to establish a primary care doctor and dentist that your child is seeing annually, so they get to know you and their family and the dynamics, make sure they're up to date on immunizations and address problems as they occur. Plus, I think families just feel safer if they go to the same physician or dentist year after year, and they develop that relationship.
And you mentioned vaccinations. There is a relatively new state law for incoming 7th and 12th graders and meningitis, right?
Right, the meningitis law. We'll be in the 3rd year of that new law next school year, so that's a big push for us. Meningitis is a really serious illness. I don't know if everybody realizes it's a bacterial infection that affects the blood, the brain, the spinal cord, and like I think the stats say like 10 to 15% of the people who get that will die. The 20%, those that live, about 20% will have serious side effects. So when I say serious, I mean deafness, a loss of a limb, brain damage. So it's really a serious illness. So it's a law that kids get it, but we really want them to get that vaccine so they won't get the disease. Yeah, so it affects 7th and 12th graders primarily. So again, I said it's in its 3rd year next fall, but 7th graders have to have at least 1 meningitis shot. That's if they were born September 15th, 2004 or later. And then 12th graders have to have 2 meningitis shots. If they're born September 15th, 1999 or later. So we're really pushing that in the high schools and middle schools right now, because ideally we'd like to see all those kids get the shots yet this school year and bring their records in so that they don't miss any school next fall. I mean, our goal is to have everybody start school the very first day of school and nobody be excluded because of immunizations, because it is a state law. It's not something that we control at the district level.
Okay.
Yeah.
And vaccines on a whole. It's important to stay in contact with your provider and make sure that those are up to date.
Yeah, vaccines are really changing. I mean, I have a pediatric background, and I can remember when I just had the immunization schedule memorized because we really didn't have that many immunizations, but there's a lot today, and it's a great thing. It protects us, and anybody who's been around for a while knows people who've had polio or other diseases that we're now vaccinated against, and we don't want to go back to that. So yeah, they're a great way to keep kids healthy.
For the kids watching, can they approach their nurse with any question they have?
Yeah, I think it's a good idea to always establish that relationship with the nurse. You know, maybe just drop in and say hi and welcome them, and they'll welcome you to the building. And you never know when the need may arise, and they'll always be there for you.
Very good. Diane, thank you so much for your time. It was great to learn more about health services.
Thank you.
Thanks for watching this edition of Extra Credit. To learn more about Des Moines Public Schools, visit dmschools.org.